going to present the first phase of the nursing process, which is the assessment phase. Assessment is the foundation of nursing care because it helps nurses to gather information about the patient's health status and identify healthcare needs. So, the nursing process. So, nursing process is a systemic method used by nurses to provide quality patient care. It consists of five steps. One is the assessment, next one is the nursing diagnosis, planning, implementation, and evaluation. So these steps helps nurses to deliver patient-centered and evidence-based care. So next we move on to the definition of nursing process. So nursing process is the scientific problem solving approach used to identify and manage actual or potential health problems. And also it enables nurses to provide organized and effective care to patients. So next we are going to see about the characteristics of nursing process. The nursing process has several important characters. It is systematic, meaning it follows a logical sequence. It's a dynamic because patient needs can change, and it is a goal directed, patient centered, and flexible enough to adapt to different healthcare situations. So the characters includes systematic, dynamic, cyclic, interpersonal, flexible, goal directed, and universally applicable. So next we move on to the purpose and benefits. The main purpose of nursing process is to identify the patient needs and provide individualized care. It improves patient outcomes, promotes critical thinking among nurses, enhances communication, and ensures continuity of care. Next, we are going to see about the assessment phase. So, assessment is the first and the most important step of the nursing process. So, during this phase, nurses collect, organize, validate, and document the patient information. The data collected serves as a basis and basic for all the future nursing decisions. So, the main objectives are they can provide a baseline data, can able to identify the health problems, and can determine patient strength and plan appropriate nursing care through the assessment phase. So next we move on to the types of assessment. Here we have four major types of assessment: initial assessment, focused assessment, emergency assessment, and ongoing assessment. So before that is the starting one is the initial assessment is performed when a patient is admitted. Focused admission is conducted to investigate a specific problem. Emergency assessment is performed during the life-threatening situations. Ongoing assessment is carried out continuously to monitor the patient's progress. So these are the steps of major four types of assessment. So next we move on to the data collection. So data collection involves gathering of information about the patient's health status. Here there are two types of data. One is the subjective data, another one is the objective data. Subjective data which is reported by the patient, for example, if the patient is having a pain or fever or nausea like that. Whereas objective data which can be observed or measured such as temperature, pulse and blood pressure. So these are the different types of data collection. One is the subjective data, another one is the objective data. So next we move on to the source of data. Here we have two sources. One is the primary source, another one is the secondary source. So the patient is the primary source of data. Additional information can be obtained from the family members, caregivers, medical records, laboratory reports, and other healthcare professionals. Using these multiple sources, it helps nurses to obtain a complete understanding of the patient's conditions. So next we move on to the methods of data collections. how the data gets collected. So nurses here collect the data through different methods like interviewing method, by observing, by through physical examination and diagnostic test. So physical examination includes four techniques known as IPPA, that is inspection, palpation, percussion and auscultation. So next important thing is after the collection of data, we need to validate, that is validation. So validation means confirming that the collected data is accurate and complete. So nurses validate information by reassessing the patient, comparing the findings and consulting other healthcare team members. Accurate data helps to prevent errors in nursing care. Next, we move on to the documentations. So, the foremost important thing is the documentation. So, documentation involves recording assessment findings clearly and accurately. Good documentation should be objective and then complete, timely, and legible. It serves as a communication tool and provides legal evidence of the care delivered. So next, at last, to summarize, assessment is the first step of nursing process and forms the foundation for effective nursing care. So through data collection, validation and documentation, nurses gain a comprehensive understanding of patient needs. Accurate assessment leads to better clinical decisions and improved patient outcomes. Thank you.